Hey guys, it's Dr. Emmer, and I'm really excited because we just posted on our Instagram feed about male Botox prevention for movement wrinkles. Now, everyone always asks, what does Botox, Xeomin, or Dysport do? It does a couple things. Not only does it help movement lines squeeze in a little bit so they can show you, can see those frown lines right here, and then raise up. You can see these lines across his forehead. Now, here's the thing. When you're at rest, relax, barely see any lines. So what this does is it helps them stop the movement so that those lines do not become deeper as he gets older. The other benefit that it does, especially in men, although his skin's a little bit more dry, but a lot of men have very oily skin, porous skin, thicker skin. This goes into the skin and controls the nerves at the level of the nerve receptors and stops the oil production and actually makes the texture of the skin look better. So a lot of patients who get Botox treatments on their forehead area always say that not only does it improve the wrinkles, it makes them look better. It makes the skin look better. So the other thing it can do too is decrease redness. And in some patients that have rosacea, we sometimes can use it on the cheek area or topically apply it with something called microampule infusion. So we're doing your first Botox treatment. How do you feel? Are you nervous? Are you excited?
A little bit of both, I think.
Okay, I always tell people dermatologists are like drug dealers because the first time you get this, you're always going to come back for it.
Perfect.
Okay, so just so you know, you're going to love it. So squeeze in so we can show everybody the 11 lines. Relax. Those are the areas that just, I know, people say that they feel like more unapproachable when they have those deep wrinkles. So we're going to focus on injecting right in the center, 1, 2, 3 little pinch. Shouldn't be too bad. This is the procerus muscle. This controls the horizontal line in this area. And then we're going to go over to the corrugated muscles on both sides, and this controls the vertical lines in those areas. Squeeze in again. Relax. We're going to follow where his muscle is. We don't need to go too far out. He has a very isolated glabellar complex here, and right there, that was the glabella. How does it feel?
Fine.
Wasn't too bad, right?
Nope.
We use my little shaking technique. Some people say they always wonder if I have Tourette's, but I don't. It's to trick people into thinking they don't have any pain. Now raise up so we can look at the forehead. Now let me show everybody, so I'm going to educate. Relax. Very high brow, but he's starting to get a little bit of hooding on his upper lid. This can happen in your late 20s, early 30s, especially in genetics if your family members have really hooded brows. How many of you in your family see your grandparents barely being able to see because the skin is hanging over their eyes? This could potentially be the case for him in the future. Right now he looks fine, but what that means is you don't want to over Botox the forehead because then the brow will come down. And that's because this muscle won't be able to pull it up. And you can see I can literally go like this and pull his eyelid and brow up. So we want to do a conservative treatment to start. We're going to do half the amount we normally would, give it about 10 to 14 days to settle, and if we feel we need a little more, we can do a little more. Otherwise, this is a subtle improvement. It'll make him happy. Raise up again. Relax. Perfect. We're just going to go right across here. Very micro Botox injection, small amount. Raise up again. Perfect. Relax. We're just going to do very small little bits. Raise up again. Perfect. Relax. Great. Raise up again. Relax. Perfect. Turn to me. Raise up again. Relax. Great. Raise up again. Relax. Great. So that is a little baby, we'll call that baby Botox. Just little micro Botox all the way across to soften everything. The area dispersion of the product is about 1 centimeter to 2 centimeters, so everything should kind of go around this area and then soften it. He'll have less movement here. It'll be a nice softer furrow, and then this will be much more even. So that's Botox. How was the first treatment?
It was good.
You did great. Okay, so that's it. We'll follow up with him in 2 weeks and see if he looks great. Take care. Perfect. See how good you were? You didn't even need numbing.
Nah.
You did great.
I had those.
Perfect.
I used to have those allergies.